Explain your ugly drawing.
My ugly drawing is talking about the bladder and kidneys. So basically what happens, you have two kidneys which then have drain into the bladder, and then the urethra is where the urine comes out, right? Now, when you have a bladder, like when they're struggling to urinate, there's a few things that can cause it. The one is you can get bladder stones, okay? So it's not stones that they eat, it's something that's formed in the body itself. Now, when there's a change of pH or when there's a change in certain levels of the urine, for whatever reason, these things start forming. So you get different sizes of them. They can be big or you can get little ones. The little ones are a problem because if they go and they sit here, they can get stuck. And remember, this urethra is probably even thinner than this, right? So if you have a stone that's sitting there and it's blocking it, it's like having a block pipe. Nothing's going to go through, okay? So what happens is they push and nothing comes through. Or sometimes if it's small enough, they'll manage to get a little bit of urine out. But if it persistently stays like that, you're going to start getting inflammation in the area, right? Now, inflammation is going to mean this thing gets thinner. So the pressure, so where it's this thick, it's not that thick. So it becomes even more difficult for the urine to come out, okay? So that's what's happening with the stone story. So the next thing that can cause it is just a bladder infection. So bacterial causes, that sort of thing can cause it. So when that happens, you're also getting a change of the pH, you're getting inflammation in the bladder. And what happens then, it becomes painful because with that inflammation, you're getting the same sort of thing where the urethra narrows, so it becomes very difficult for them to urinate. And when they do urinate, it's quite painful because it's like pushing against something, right?
It seemed to be quite painful. Yeah, like he's kind of slowly kind of crept out of the box and, you know, just...
It's not denied, it's very uncomfortable. And then the other one, which is, it's called feline lower urinary tract disorder, which basically we don't know what causes it really. We think sometimes stress triggers it, but it's a similar thing. But for whatever reason that's happening, so it's not bacteria or stones, but that bladder, the urethra, it blocks, and then it's the same thing. But there's not a physical obstruction, it's just with stress you're getting release of certain hormones and whatever, and that then causes that blockage. But all of them, any one of them, basically the symptoms are the same. So they try to go to the litter box, so they'll squat, try and go for a while. Sometimes something comes out, sometimes it doesn't. But like this just started today, so you're getting, or you noticed it today, which is good because what happens is if you leave it for longer, then it's just blood that comes out, and they can get quite sick because you must remember, if this is blocked, then you can end up with acute kidney damage because the kidneys are filtering into the bladder. That's filling up, it's not going anywhere, so you get damage to the kidneys. So that becomes a serious problem. So it can be life-threatening.
Okay.
This is an emergency. It's not something you can leave. It's like you can't urinate for 3 days. It's very uncomfortable, but also, like I said, it's life-threatening because you can get changes in kidney levels and all the rest of it.
Yeah, so it's good that I got him the soonest appointment I got.
No, it's perfect you did that. You did the absolute right thing because there's nothing you can do at home to try and fix something like this. Unfortunately, there's really nothing you can do. So what the steps would be is basically, we need to see, firstly, there's kidney damage, right? Usually with that, blood test will show us what's happening with the kidneys, what's happening with the enzyme levels there. The next thing is x-rays, because sometimes, I know we're talking about the bladder, but sometimes they also can strain if they haven't gone to the toilet, if they're a bit constipated. So it's, with an x-ray you can see both, but also with an x-ray you can see how big the bladder is, and you can sometimes see stones, if depending on the size of the stones. So if it's stone related, like uroliths, you'll be able to pick that up on an x-ray, you'll be able to see it, right? And a little bit more, so if you have tiny stones which you can't see on an x-ray, that's where the ultrasound will come in, because the ultrasound will basically show you how, it gives you far more detail with soft tissue structures, so you'll be able to see if the urethra is inflamed, what's happening to the bladder wall, if that's thickened or not. So it gives you an idea of how severe the damage is, right? And also it also helps to get a urine sample, because then you're doing it under a guided, with ultrasound you're doing it under a guided thing, so you can see exactly that you're in the bladder and you're getting a decent sample.
Okay.
And obviously test the urine. So the urine test will will tell you if it's concentrating or not, if there's any infection, bacteria in their blood, that sort of thing. And then you manage it. So normal management will be, for now, obviously it's painful. So pain management for sure, without a doubt, you'll need to get something for pain. Once you know what it is, then you can do step 2 and treat from there.
Okay, great.
Okay, so that's basically it. There's the other kidney.
So what are we doing, Shereni?
Doing an ultrasound on a cat's abdomen. See, I haven't lost it.
What's
So
wrong?
basically, this cat is showing signs of struggling to urinate. So it's been going to the toilet, but nothing's been coming out. So straining and no urine coming out. And still eating and drinking normally. So we want to see, one of the causes for blockages are bladder stones. So we're looking for the bladder and looking at the kidneys and to see if we can find any abnormalities. And then treat from there.
Okay. So Shereni, what are we doing?
Okay, so we've had a blocked bladder which we needed to catheterize. So it's a urinary catheter that you put inside so the bladder, the urine can drain out. So that's what we've done. And we'll test the urine to see what's causing it. And now we're just going to empty the bladder and flush it out.
And then you might want to show that around the size of the length of the catheter. And see how long it is.
And that's gone up the penis.
That's gone up the penis all the way into the bladder. And can you imagine how uncomfortable the cat was and not able to urinate?
And we're not actually sure for how long, are we?
No, we're not. I think it was for longer than a day, I would think.
And this isn't the first petri dish of
No.
urine.